Hello, church family. Happy Sabbath to you. My name is Nate, and as some of you know, I am a current frontline provider working as a respiratory therapist in the emergency department. I've been doing this for about 12 years now, so I have a significant amount of experience, and I get the privilege to also teach this knowledge to resident doctors, attending doctors as well, nursing students, respiratory students, and fellow respiratory therapists as well. So I'd like to talk to you a little bit about COVID-19 and what I've seen and what my experiences are. I get a lot of questions asked about it. First off, what is COVID-19? It's a virus in the corona family that's a brand new virus being introduced into the human body for the last few months now. It got transferred over from an animal to human, and so that makes it unique. But this is something that we've never experienced as a population before. My first impression of this was just this was going to be a bad flu. We get over it, we'll be okay. But as time progressed and I started to learn more and I actually got to see some of these patients come in, it changed my perspective quite a bit. Okay. One of the other questions I get is this pandemic a real thing? Or is the media coverage just blowing it out of proportion? I could tell you with a surety that COVID-19 is a real thing, and it is a serious matter. It doesn't affect everybody the same way. We're seeing our younger population not being affected, but we're seeing our older population being more affected. For example, having more severe symptoms of it. It does act like a flu, but it has some very different things about it. And we're still learning more about it. So all this stuff could change tomorrow, okay, as we learn more about it. But it seems to be potentially increasing blood clots in the blood, causing inflammation in the vascular system, but causing pneumonia, typically bilateral pneumonia, which means both sets of lungs are affected. And then when it really gets bad in the lung, it goes into what we call ARDS, which is acute respiratory distress syndrome. And when it gets to that means your body's just not able to get the oxygen that you need into the body. Okay, so we have to try to do it artificially, but even doing it artificially, like with a mechanical ventilator, it's just unable to do so because the pneumonia in there is so bad. But there's also some other factors that are going inside the body, again, that we're still learning, that's affecting that as well. So those people who have higher risks, are those with other comorbidities, such as heart disease, diabetes, people who are prone to blood clots, who may be on blood thinners, okay, so stroke risks and stuff, poor health, obesity, any type of circulatory problem, are more at risk. But if your body is already unhealthy, okay, granted that you may not be sick, but you're unhealthy, you're going to be at a higher risk to get the more severe symptoms associated with COVID-19. And the worst one is obviously death. Okay. Luckily, the death tolls percentage-wise as a whole seem small, but they're actually pretty significant if you look at it at a big picture look. So we're again learning more about this every day, but we're starting to see reports that it potentially might have some long-lasting effects as far as you could get better, but you may have some lifelong differences inside your body that could be affecting you. Okay, mainly the lung. Your lung looks different, meaning it's damaged. Okay, so if you have good lungs now, and potentially COVID-19 can affect your lungs and cause permanent damage. Okay, so what we're trying to do, what I'm trying to do is help others realize that this pandemic, this COVID-19, is a real thing, and I definitely don't want to see anybody, get COVID-19, but also we want to try to help protect you guys as much as we possibly can. Okay, so following our guidelines that are being shouted to us, it seems like they're there for a reason. Okay, one of the biggest one is masks. Okay, I hate these things. I do, and I love them. Okay, because they're uncomfortable. They're hot. Okay, you can't breathe as well. I mean, try doing CPR with an N95 mask. These are a lot thicker. Okay, and more difficult to breathe through. But you know, who do they ask to do CPR sometimes? Me. Okay, because I'm a bit bigger than some others. Okay. So it's difficult. I get the reason why. I mean, they're uncomfortable. I understand that. But do they do something for us? Yes, they do. They help protect others. Okay, they help protect you guys. Okay, one of the biggest reasons is if the person who has COVID-19 wears a mask, okay, he may not even know he has COVID-19, but if he wears a mask, him coughing or talking or sneezing is going to go right into the mask and potentially not everywhere. Okay, so wearing a mask is important and it does help. Okay, hand hygiene. Wash your hands for 20 seconds. Okay, what we do in healthcare is we typically wash our hands, and then after that we put hand sanitizer, and we do that, and then we glove up. Okay, so we do it significantly a lot. And sometimes we're like, hand sanitizer, glove, take off glove, hand sanitizer, wash our hands, hand sanitizer. I mean, it's like their hands are bleeding, okay, because they're washing their hands so much. They're cracked and dry. Mine don't do that. I think it's just because they're just so strong. Just kidding. Anyways, hand hygiene is really important, okay? So please wear a mask to help protect others, to protect yourself. Okay, they do help. Okay, they do help to a certain degree. I understand that they're not 100% foolproof, but they do help. So I'm currently self-quarantining away from my family because I don't want to risk them in any way. But I miss them very much. And if I have others supporting this as well, hopefully we'll get to the point where the numbers aren't so bad, and we can again get back a little bit to some normalcy. Although the world probably won't be normal after this, but definitely, hopefully, we'll be better. Okay, if everybody does what we're asking them to do. So COVID-19, the symptoms. I'd like to go over some of the symptoms so that way you guys are aware. You can have a fever or chills along with it, a cough, usually a dry cough, if it's kind of constant and dry. Here's one of the more important ones. If you have shortness of breath or difficulty breathing, that's a serious symptom. Okay, that may indicate that you need to go into the hospital or the emergency department to get help. Okay, usually when it's shortness of breath or associated with it, your oxygen levels are down. Okay, and you can't get more oxygen out of air. You need to have supplemental oxygen that's provided, at a hospital. Okay, so we need to increase the overall oxygen that you're breathing in to help supplement it, because whatever's going on inside may be potentially compromising the amount that you're able to absorb. If you have fatigue, okay, if you feel tired, muscle or body aches, okay, here's an important one, because we've had cases where they only have this symptom, and it's new loss of taste or smell. Okay, so they don't have any other symptom associated with COVID-19, but they have this. That's an important one. If you start to realize that could be an indication that you need to call your doctor, okay, and see if you can't get tested. And then obviously you want to self-quarantine. You want to make sure that you stay away from others to prevent the spread. Okay, you can have a sore throat associated, congestion or runny nose, nausea or vomiting, or diarrhea. Okay, so if you have any of these symptoms associated, you need to call your doctor and see if you can't get scheduled for testing. Make sure that you stay away from others and prevent. So we ask that for any who potentially might be in contact or have gotten this, that our church family does support them in as much as they can. because they're not going to be able to get out of the house. Okay, they can't. You don't want to expose your family. You don't want to expose others to. That's irresponsible. So support. Those people definitely need a lot of support. Okay. So you can have COVID-19 and actually not even have any of these symptoms, and it could be brewing inside your body. And so you're less likely, if you're not exhibiting symptoms or a fever, less likely to transmit it, but it's still a possibility. Okay. At time of exposure, it's usually 2 to 14 days that you might develop the symptoms. Okay, so you could be exposed to it, and 14 days later, then you can start having symptoms. Okay, so is this thing real? Yes, absolutely. The people that are affected, and again, it seems to be, we don't know who gets affected more. Because your other issues, yes, can complicate that matter, okay, when it really latches on, but it seems to be affecting people almost like, randomly, and they're trying to find these things out. There's studies done as far as what blood type, you have that may increase your risk or decrease your risk, okay, but these are things that are still kind of up in the air. This is something that they've been studying, and they've been studying this thing intensely. It's more than anything else in the world, it seems like. And so people are definitely on this, okay? But, I mean, it is a real thing. It is a real thing, guys. So I ask that you protect you and others as well. And I know that's in your heart. You love Christ. And that love is exemplified, or shown to others, And so you'll have a natural tendency to help others. And so that's the whole point of this message, okay? It's definitely to support you guys, to give you a bit of knowledge. You can always ask me questions. I'm constantly learning more about it every day, and being treated, or helping treat others with this disease. So I ask that you trust in God, okay? Because if He is with us, who can be against us? Okay, it doesn't matter what's out there, and we know that the world is going to get worse and worse. As the time gets closer for His return, and hopefully you could use this as this witnessing tool, for Christ, for the love of Christ. When you really care for someone and they genuinely see that, I mean, doors are open in their hearts, and you can reach them. Where otherwise it might not have been possible. Okay, potentially use the mask to advertise. I mean, write a Bible verse right there. Okay, I love Jesus. Boom. Everybody's gonna be wearing these. Okay, so you can, and you have to look at their face, right? Because it's just right there, and so it's just a natural, a tendency to look at the mask. Okay, so if you have patterns that you guys decide to make your own masks, or have have a message there, or have something that draws the attention. It could be a conversation starter, for sure. So trust in God. Okay, pray for others. Pray for me. Pray for my family. Pray for our church family. And if any of you guys get it, stay healthy, eat healthy. Our health message is strong. Okay, it's there for a reason, for times just like these, right? Don't let this discourage you, but let it encourage you to draw closer to God. Okay, I think this could be a big eye opener for us, and it's not something that we should give up. Hope, because we have such a big hope that's soon to come. Thank you, guys. We love you, and have a happy Sabbath.